Have you ever wondered about the best way to safeguard your sexual health, especially when it comes to infections that often show no signs? For women identified as high risk, annual chlamydia testing is generally recommended by health experts. However, depending on specific factors related to your sexual activity, more frequent screening might be advisable. The primary reason for these recommendations is that chlamydia is a common bacterial infection that often presents without any noticeable symptoms, earning it the nickname silent infection. Despite being silent, untreated chlamydia can lead to serious and irreversible health complications such as pelvic inflammatory disease, infertility, chronic pelvic pain, and even a life-threatening ectopic pregnancy. Testing frequency is directly tied to an individual's risk profile because higher risk factors increase the probability of exposure and infection, making proactive and regular screening essential to catch it early before complications arise. You are considered high risk if you have a new sex partner, multiple sex partners, a partner who has other sex partners, or if you consistently do not use barrier methods like condoms. Other factors include a previous diagnosis of a sexually transmitted infection or being under the age of 25, as younger women tend to have higher rates of infection. In cases of very active sexual lifestyles with multiple partners, some healthcare providers may recommend testing every 3 to 6 months to ensure timely detection and treatment. Determining your personal testing frequency starts with an open conversation with your healthcare provider. Be honest about your sexual activity and risk factors so they can give you the most accurate and personalized advice. Chlamydia testing is quick and easy, typically involving either a simple urine sample or a swab from the vagina during a pelvic exam. Getting tested regularly empowers you to take control of your health. Understanding your risk level and getting screened consistently are two of the most powerful tools you have to protect your long-term reproductive health. Taking proactive steps like regular chlamydia testing, especially if you are at high risk, ensures that any potential infection is identified and treated promptly, preserving your well-being and peace of mind.